Hi friends, welcome to Diagnox. Today we have taken this limited FOV 6 into 7 centimeter CBCT scan using new Tom CBCT machine to evaluate edentulous region 2-1. Incidentally, you can see an impacted teeth 2-1. We are just seeing the crown of 2-1. Now we have to assess whether there is any root, whether this crown is related to the root of 2-2, whether there is any cystic transformation, whether there is any follicular enlargement, whether this teeth is related to the nasal floor, whether this teeth can be orthodontically brought down or this teeth requires extraction. We would assess these things with the help of other tangential cross-sectional slices. So stay tuned. From this panoramic slice, we will just go into the MPR. First, we would assess the axial view. So axial view would give the overview of teeth, and from the crown of 1-1 you can clearly appreciate the edentulous area. We are going more superiorly towards the root area. You can see that the labial cortex is underdeveloped, probably as a result of teeth being not in the alveolus. And we are still going superiorly where you can see the crown and the root of teeth. You can see that there is definitely root, but the crown is positioned more towards the labial cortex. It's causing slight expansion of labial cortex, whereas the root is directed towards the palate. So the root is present within the palate. This is a teeth which is positioned anterior-posteriorly, where the crown is present anteriorly and the root posteriorly. And we would look at the 3D slice to get further clarity. So this is a 3D slice where you can see the edentulous area and you can clearly appreciate the crown. You can see that this is the palatal aspect of the crown, this is the incisal aspect. You can see that the labial aspect is definitely below the floor of left nasal cavity. So this teeth has superiorly slightly displaced the floor of left nasal cavity, and bonding an orthodontic bracket onto the labial aspect would be very difficult. Probably we can try an orthodontic bracket on the palatal aspect and pull it down inferiorly, but it's a difficult task. So we would store this image and we would go on to MPR further. We would assess the teeth coronally with the help of coronal scans, and moving from the anterior aspect, you can see that the nasal airway being clearly seen anteriorly. Now we are going into the position where you can see the crown of 1-1 and you can see the tip of crown of the impacted 2-1 going posteriorly. You can see the crown of 2-1. You can see the nasal floor left side being lifted superiorly by the impacted teeth, and you can see the root portion which is present just below the left nasal floor. So this is an anterior posteriorly positioned 2-1. So in the coronal slice you are going through the cross section of root where you are just seeing the root and the root canal. So stay tuned to Diagnox for many more interesting videos like this. If you have not liked the channel, please like it, subscribe to the channel for many more interesting videos. Thank you.